My name is Nurse Pam and I'm here with our patient. All the things that I've planned for her actually is to make her look more rested, just give her a full facial rejuvenation. My plan for her is to do some dynamic wrinkle relaxation. So I'll be doing Dysport, and that way it looks more natural on her. We'll be doing it on her forehead, her crow's, and her brows. And then moving to that, we'll add some volume replacement on her mid-face. We just finished pan facial rejuvenation with Radius. Her skin, actually, the texture already improved. Now we're going to be doing PDO threads. It's made of polydioxanone, and it's a similar component as when we do surgery. The first layer of the suture, that's the one that dissolves. And while it's inside the tissue or the skin, it actually helps stimulate new collagen. In her case, we're going to use the barbed threads that help lift. And then at the same time, we're going to do some twist threads that are actually good for stimulating volume. So meaning more collagen stimulation on specific areas.